Casey, for those of you who haven't seen any of my videos before. But I am putting out a series of videos on rebuilding back my core. I had 2 little girls within a year and a half. We have a 1.5-year-old daughter, and then we have a 6-week-old who's right here next to me making some grunting noises, so you might hear those. And so I just wanted to take you guys through my postpartum journey of trying to get back into fitness, reclaiming my core, and doing a series right now on basically how I am trying to get my diastasis recti to heal and get strong again. So first, a little bit about me. I'm gonna take my little girl's gonna join us. Come here, sweetie. So after my first pregnancy, I had a diastasis recti, or a DR is what I'm going to say throughout the video, so I don't keep stumbling over my own words. And I had started getting that to heal up and get strong again, and then I became pregnant again. And so now, after basically a year and a half plus 9 months, so over 2 years of either being pregnant or postpartum, I'm gonna have quite the journey getting my DR to heal and become strong again. So I'm gonna take you guys on that journey with me. So today we're gonna go over first what a DR is, and then also the first steps of trying to get it to heal and become strong again. And then at the end, I will share with you a link to a 10-minute guided video on the initial kind of exercises you can do to start getting that to come back together in a gentle manner, that while you're still letting the rest of your body heal. So first off, a DR is when, you know, your 6-pack abs, that line between the 6-pack abs, or if you're looking at a photo, anatomy photo, that white stuff, that's when that white stuff starts to separate. And it's completely normal. And I can't emphasize this enough. Like, this needs to separate and happen in order to let the baby grow. Okay, motherhood. All right, so like I was saying, having a DR is completely normal. That separation has to occur when you're pregnant in order to make room for the baby. And then after you give birth and stuff, over time it starts to heal back. Now for some women, they need a little extra help getting to heal back, or it doesn't completely heal back. And that's where some specific core training can be helpful. And so really how we want to fix it is, one, restoring our breathing mechanics and the mechanics of how the diaphragm, the transverse abdominis, so those are kind of like the corset muscles of the abs, and the pelvic floor are working together as a team. And that's going to be a whole separate video. You want to load it. So that white stuff, that linea alba, is a tendon. And so in order for tendons to actually get stronger and to tighten, you need to load it, but it's learning how to appropriately load it. So how much can we stress it and use it that helps it, and what is too much for it. And then also doing a kind of like specific program. So I am experimenting with, there was a research article that came out on a core strengthening program in postpartum women. This came out in the Journal of Women's Health and Physical Therapy right about just a couple months before I actually had our daughter. So I've been playing around with that and seeing if that's going to help my DR start to close up. And I will say, after doing it I've been doing it for about 2 weeks now, a variation of it, because it's a little early for me to be doing it. I definitely say it's made a big difference compared to my first pregnancy. My core does feel like it's functioning better when I am lifting our daughter and doing stuff around the house, versus last time I felt it wasn't painful, just didn't feel like me. That's the best way I can describe it. So what I want to do now is teach you how to see if you have a DR yourself, and then to show you what it should look like when those muscles are coming together. So when you're engaging your core muscles, you want things to kind of come together or to tighten, in that there's tension in between your 2 6-pack abs, versus coning or divoting inwards. And so that's what I'm going to show you now. And then I want you to stick around at the end. I will have a link to a 10-minute guided program, a mixture of what was in here and then also some changes I made based on what I like for my own body. But it's designed so you can play it and then hit pause if the baby's crying or you need to do something, and then play again and just listen to it without having to think yourself, because you're already thinking about so many other things right now. And then we'll have a couple more videos after this going over progressions. So this is the initial stages, going over how to incorporate the glutes, and then also the next level exercises for your abdomen, once it's appropriate for you to do that. Okay, so now I'll show you my coning and my diastasis, or diastasis, depending on how you like to say it. So as you can see, when I start to sit up like this, you can kind of see a little bit of coning through here. I'll show you with my shirt off. You know, see after pregnancy how you have all this loose skin down through here, hoping that will go away, but we'll see. But when I go to lift my head up like this, you can kind of see how things raise up through there, which is a lot better than it was a couple weeks ago, but I failed to record a video of it. But when you're checking yourself for a diastasis, you're looking for fascial tension through here. So like when I push down, there's tension, and then it's kind of like I can just keep pushing down and I can kind of feels a little icky, a little weird. My diastasis is higher up through here. A lot of times women get them down here, but mine's up through this area. And so then if I don't brace and I just lift my head up, you can see how I can, like here, tension, and then I can really push down there. And I would say it's probably, I've got a little kiddo getting a little unhappy, about 2 fingers, which isn't bad, but what we really want is less about the distance and more about that fascial bottom. So when I go to lift up, and I'm bracing a little bit this time, I want to have I want to be able to feel like a little bit of, I want to feel tension here like I feel here, or like here. You see there's tension. So what I'll be working on the next coming weeks is making it so this is stronger, so I can feel that tension. I guess I better wrap this up because the little one needs us. And that's going to be just through loading it, but loading in a manner where I'm not getting that like big bulge like that. That's not correct, and actually doesn't feel good. But loading it in a manner where it's this flatter, not getting that coning, and just letting time heal. Here's a link to the 10-minute core video. It's an intro to training your core in the early weeks of postpartum. So I would say anywhere between 2 and 6 weeks, depending on what your recovery process has been like. And for more content, subscribe to our channel. Please comment, let us know what you're thinking and how we can change things and what you're looking for.